we are doing a female well exam. Generally, we do the height and weight before we get into the room. And now we will see the setup of the exam. The patient will need a drape for her lap, as well as a gown to put over her top half. I put a drape over the Mayo stand to put all the supplies on. The supplies are kept in the drawer under the table. I'm getting out the Pap smear kit. This is the drawer that we keep the speculum in. The doctor will need a pair of gloves. And some lubricating jelly. Those go on the tray as well. I will fold the paper over the instruments just to conceal them while the patient comes into the room. Right this way. You may have a seat in the chair.
Thank you.
So I understand you're here for a well exam today?
I am, yes.
Okay, good. Let me just open up your chart here.
Okay.
Do you take any medications on a regular basis?
No, I do not.
Okay. Do you have any medication allergies?
None that are known, no.
Okay, thank you. Do you know when you had your last tetanus shot?
Probably when I was a child.
Okay.
Yeah.
We'll probably update that for you today,
Oh, okay.
if that's okay with you.
Sure.
Okay. Do you have a tobacco history?
Previously I did, but I have stopped since then.
Okay. When did you quit?
About a year ago.
Okay. Are you around secondhand smoke?
No.
How many caffeine drinks do you generally have a day?
Probably about 4.
Okay. And do you use alcohol?
Just on
occasion?
Yeah.
Okay. What type do you like when you have a drink?
I'll usually drink beer,
Okay.
if given the option, yes.
And do you get regular exercise?
Probably 2 days a week. I'd like to get more. I know
Okay.
it should be more.
What type of exercise do you do?
Jogging.
Okay. Is there any family history of heart disease in any females under age 65?
Yes, there is.
Okay. What about in males under age 55?
Yes, there is.
Okay. Okay, now I'm going to take your blood pressure.
Okay.
Okay, just rest your arm there. Okay, that was good. That was 116/72. Okay, let's check your pulse.
Okay.
Okay, good. That was 60. Okay, do you need to use the restroom before we begin?
No, I'm okay.
Okay, good. Well, the doctor will come in and talk with you before we get it started.
Okay.
Okay, and before we have you get undressed too. Okay?
Thank you.
Thank you.